Very good morning, guys. So, welcome to one more PYT, previous year topics of medicine, Inicet. So, one of the doctor has asked me, sir, shall we discuss something about Parkinsonism? So, it is the most asked topic in Inicet as well as NEET PG. Of course, not in Inicet, not in NEET PG, even some of the FMG examinations, everything you get Parkinsonism, because Parkinsonism and Alzheimer's disease are two fan favorite topics of examiners, right? Alzheimer's is most common condition we see in the adults, as well as Parkinsonism is also most common condition. Even if you know that one of the famous international boxers, Muhammad Ali, he was dead due to Parkinson's disease only, due to repeated punches on the head towards the parietal cortex. It led to landing up him into Parkinson's disease. So ultimately, I think his final stages were so much sad, like you can't even imagine what sort of scenario he has faced in his final moments of his life, right? But ultimately he was dead due to Parkinson's disease only. Okay, so without any delay, we'll get into the topic, right? So today's question regarding Parkinsonism is, the feature of Parkinsonism is which one in these four options? Either it is paralysis on one side of the body, or the intentional face expressions that they give while they are making some conversation, or is it the intentional tremor, or it is something like rigidity that is present during the flexion. Now what is the answer? Anyone, please try the answer. So you will be given 5 seconds, so just think some answer. Just keep it in your mind and check it whether it is correct or not, right? So you have good options there. I think two of the options look similar. You might get confused, but no problem. I am here to clear all your confusions, right? So let us get into the question. So here the examiner wants to test your pinpoint concentration, the feature he is asking, the feature. So let us discuss some of the very good clinical findings of the Parkinson's disease. Some of the very good clinical findings of the Parkinson's disease. Now the first one is you see tremor, second one is you see rigidity, third one is something called bradykinesia, the decrease in the movement of the body, that is bradykinesia. And fourth one, it is very important, I'll just write it with different color, the postural instability. Postural instability. Now these are the features, the very important cardinal features you see in a Parkinson's disease. Now what about tremors? Tremors, you observe something like 4 to 6 cycles per second. That is the tremor rate. So 4 to 6 cycles per second, which is the most conspicuous at rest, which are actually most conspicuous at rest, and it can increase when the patient undergoes for emotional stress. These tremors get increased, and it will decrease, or it will be of less frequency when the patient is having some good voluntary activity. Remember this statement, it is very important. People who are going to Nimahans, just check all these points. These are very important. Okay, now the tremors, they are present in all the limbs. There is no difference in it, right? The tremors is present in all the limbs, but it's commonly confined to one limb, or the limb on one side, okay, to one limb or to the limbs on one side for months or years before it becomes generalized. Generally it is one limb, or it sometimes it can be present even with two limbs on one side, but after some years of progress, automatically it will be generalized. So in some patients, tremors may be absent also. That one also you should remember. Tremors is not a significant feature you see in all patients of Parkinson's. Some patients it will be absent. Now coming to the rigidity. What is rigidity? It is the resistance you generally observe to passive movement. It's the resistance to passive movement, and this is the reason, this rigidity which you observe in the Parkinson's disease is the very one main reason which give the Parkinson's patient the characteristic posture. That is, what is that posture called? A flexed posture. This flexed posture is present in Parkinson's disease patient because due to rigidity. Rigidity means the resistance to the passive movement. Now bradykinesia. Bradykinesia means decrease in the movements of the body. That is called a bradykinesia. Now it is the most disabling symptoms when you speak regarding the Parkinson's, and it is actually manifested as a slowness of voluntary movement, and also there will be a reduction in automatic movements, such as, see, you speak like, see, these are automatic movements, something like swinging of arms. See, while you are walking, automatically you swing your arms, right? You don't swing them something like intentionally. Automatically you get that movement, swinging of arms while you are moving. So those type of movements, they will be reduced, and the effective voluntary activity may briefly be regained during an emergency. For example, I will tell you what is meant by that statement which I spoke. See, for example, he is a Parkinson's disease patient. Suddenly a vehicle has approached him face to face. Now in that emergency situation, what are the so-called, his voluntary activity will be regained. Suddenly it will get regained. That means if the patient faces any emergency situation, then his voluntary activity will again spike, increases during a emergency condition. Okay. Now they have a characteristic phase called a immobile phase. Immobile phase. You all know that if you have really seen a Parkinson's disease patient, they have an immobile phase with widened palpebral fissures, as well as they have an infrequent blinking and a certain condition called the fixity of facial expression. There will be fixity of facial expression. This is very important, commonly seen in Parkinson's disease patients, because there will be bradykinesia. Most of the movements will be decreased. Okay. Now, if you ask me one more important thing about postural instability, we will just write it down in the next page. If you ask me about the gait of the Parkinson's disease patient, it's very famous, which is characterized by small shuffling. I'll write here, small shuffling steps. There will be small shuffling steps, right? It is very characteristic gait of Parkinson's disease, and there will be a loss of normal automatic arm swing, which we generally do in the walking itself, and there will be an unsteadiness on turning, and there will be difficulty in stopping themselves. And there is one more common thing, that is there will be a tendency to fall. This is commonly seen in Parkinson's patients, right? So with all these things, we will just go back, we will just solve. The feature of Parkinsonism is, what is the answer now, everyone? It is rigidity during the flexion and extension of the limb. Why? What is the reason? We already discussed. Because rigidity means it is resistance offered to the passive movements of the body. Resistance offered to the passive movements of the body. Right? So this is one of the important feature of Parkinson's disease. Okay? Everyone okay or not? Everyone okay or not? Okay. So paralysis. Why paralysis? No, not paralysis. Why some of the doctors are saying paralysis? No, not paralysis. Face expression, intense. Why they will have face expression? So see, that is what I am speaking. No, they will not have any face expressions, man. No, why are you speaking this? See, they have something called fixity. Fixity means no face expressions. Fixity of facial expressions. Remember, please don't mistake these statements. The examiners, that is their point. They want to confuse you. And it is intentional tremor. No, there will be tremors, but don't make it an intentional tremor. No, no, no. And this paralysis is big no. No paralysis will be there. No. See, this Parkinson's patient, he might have a hypertensive condition or a neurological stroke or a cerebral vascular accident, but that doesn't mean the paralysis is due to Parkinson's. No, 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 no. Parkinson's exclusively is a neurodegenerative state, right? You might have some comorbidities, but that doesn't mean. Here the examiner asking the feature itself speaks, that is rigidity. Don't think about all this nonsense, right? So rigidity during flexion and extension of the limb, the B option is the answer. Don't confuse, man. Okay, so we'll meet up with one more topic, important topic of medicine.